Good morning. This is Bonnie Fort. I'm going to present my slides for the mental health nursing psychobiological disorder, bipolar disorder 1. We will cover patient profile and discharge planning, anatomy and physiology, nursing process, pharmacological therapies, patient and family teaching, and patient resources. Psychobiological disorder, bipolar dis-1 disorder, contributing factors, biological, psychological, and environmental. The anatomy and physiology of the brain that is affected with bipolar 1 disorder. It's a dysfunction in the prefrontal cortical regions affecting executive decision-making, expression of personality, and social behaviors. It involves the hippocampus, including the amygdala, which affect memory and emotional regulation, contributing to emotional liability overall. They may have gray matter loss as well. The neurotransmitters most likely to play a role for the expression of bipolar disorder and the levels of serotonin, dopamine, norepinephrine could be high, low, or not enough. There indicates a dysfunction with these chemicals or hormones. Biological factors. There is a genetic familiar component with 15 to 30% greater if a parent has the disorder. Concordance is high amongst twins, more common in adults with high IQs, higher levels of attainment in education, occupational status, and creative artists as well. Neurobiological neurotransmitters that are affected, dopamine, serotonin, norepinephrine, as I said before, overabundance or not enough. Maybe from a dysfunction of these neurotransmitters or hormones or brain chemicals. Brainstem is involved, dysfunction in decision-making, emotion, and memory. Gray matter loss may be evident. Environmental, seen across all races and ethnicities. The patient profile that I will be reading about is patient Will Smith, 53-year-old male, African American. He lives with his wife and 2 children, male and female, ages 20 and 23. They reside in the home for the past 20 years. They live in Saskatoon. Mr. Smith works as a letter carrier for the Postal Service. Mr. Smith considers himself an actor, enjoys participating in theater productions at the Persephone Theater. Marital relations have been strained due to Will's chronic bipolar disorder and recent admission for acute mania. Diagnosing and history. He's had bipolar 1 disorder, diagnosed 20 years ago. He has been admitted for exacerbation of manic episode and noncompliance with the medication Lithium. Has history of 4 episodes of mania in the past 5 years. His comorbidities of anxiety and depression are evident. Nursing process. Assessment is with therapeutic communication. My question was, what's happening now, Will? Presenting reality on what is happening here and now. Trust and understanding, suggesting that I care what is happening and I have empathy. My next question is, have you been able to eat or rest? I will convey warmth and encourage patient to focus. Heightened anxiety will necessitate short and clear questions to allow him to focus. Nursing diagnosis, treatment goals, and interventions. I have received the nursing diagnosis from NANDA. Number 1, imbalanced nutrition, less than body requirements for Mr. Smith. And the second diagnosis is risk for imbalanced fluid volume. The treatment goals: number 1, for the first nursing diagnosis, the patient will eat small, nutritious snacks and high-calorie protein, drinks frequently and often during the first 24 hours of inpatient care. Number 2, for the second nursing diagnosis of NANDA, patient will be well hydrated as evident by stable vital signs and adequate urine output within the first 6 hours of admission. Interventions for the first diagnosis: offer frequent nutritious finger foods and high-calorie protein drinks every hour on the hour in the first 24 hours of admission. Patient can eat and drink whilst activity levels are high, example pacing. Patient will be offered water every hour on the hour for the first 24 hours of admission. Offer water bottle whilst activity levels are high and when he's pacing. Monitor urine output every 8 hours and vital signs every hour until stable. Patient and family teaching: lithium. For lithium, the medication that he will take, you and your doctor have agreed on continuing lithium as a treatment for bipolar disorder. This medication can have very positive effects. You have reported the manageability of your life whilst taking this treatment. I will outline for you and family of some possible untoward effects to be aware of. Number 1, your lithium dose has been increased. We need to monitor your blood levels of the drug for therapeutic levels and potential for toxicity. We will monitor levels of calcium and thyroid function and kidney function. Watch for symptoms of toxicity, which include increased confusion, increased urine output, abnormal body movements such as staggering or hand tremors, change in your blood pressure readings. I will include written information regarding toxicity that you and your family can take with you. Other symptoms to be watchful of include nausea, vomiting, dehydration can occur, abdominal pain, muscles and sore joints, increased fatigue, and recurrence of depression. Blood tests will be done in 5 days and then every month or sooner depending on the dosage change or abnormal results. Please report any of these symptoms immediately to your local emergency department and ring for ambulance if necessary. Do not stop taking lithium or you can expect relapse of your symptoms. Continue with a healthy diet and exercise. The resources and community supports that you can use, take home with you and your family. You can call Dr. Reed at 123-456-789, Psychiatric Services. Dr. Freud, Psychiatrist, 333-333-4444. Ambulance, of course, is 911. Bipolar support groups in Saskatoon, 306-65555. Canadian Mental Health Association Emergency Hotline, 306-270-9181 or 306-384-6200 for immediate help. The Canadian Mental Health Association by appointment, 8 to 4:30, Monday to Friday. Ring 306-384-9333, and you can contact them by email at info@cmsaskatoon.ca. Please keep these numbers in your phone and ensure your family has the same numbers with them. My references are on the last slide. Further to the discussion board, the most important thing that I've learned in mental health nursing was at the very beginning of the course when we watched a Dr. Lucy Hone. She is from New Zealand, so she's close to my heart. We watched a video on the 3 secrets of resilient people. The first secret to help you navigate through life's ups and downs is that you recognize that stuff happens in life, and it does not show any favoritism in any walk of life. It happens to everyone. To remember the good in most things, that something can be turned around from a very negative position to have a silver lining. Also, a study was done concerning this talk that Dr. Lucy Hone was speaking of, and they had a study subjects for listing down every night or at some point through the day 3 positive things that have happened to you in the day. And as it turns out, the overall effect was changing these people and their way of life and how they viewed the world. And another thing was to be kind to yourself as we go through and navigate life's twisted turns. Also, the last point for resiliency was asking yourself a question: is this helping me or is this hurting me? And I've used this strategy myself, and it just helps to sort out the things that really, at the end of the day, are not working for me, and somehow I lose my peace in the process. And the most surprising thing that I have learned in mental health is that you can have a mental illness and still have good mental health, and that mental health is fluid and operates on a continuum. That surprised me. The next was one thing that you will carry forward into my nursing practice. And I have used this strategy many times throughout my nursing career, that we will use mental health nursing in all of the disciplines of nursing, no matter where we work. And we'll use this knowledge in every therapeutic area that we may find ourselves after graduation. So there was many helpful things that I reviewed in mental health nursing. It was an enjoyable course. And Mrs. Bonnie, thank you very much.